How is a lung cancer lymph node biopsy done with FNA? Have you ever wondered how doctors diagnose lung cancer? One important method is through a lymph node biopsy using fine needle aspiration, often called FNA. This procedure is minimally invasive and helps doctors determine if cancer has spread to the lymph nodes. Let's break down how it works. First, the doctor needs to locate the lymph nodes that may be affected. They often use imaging techniques like ultrasound, computed tomography, or endobronchial ultrasound combined with bronchoscopy. These methods guide the physician to the right spot, especially for lymph nodes that are deep in the chest or near the airways. Once the lymph node is identified, the procedure can begin. Depending on how the biopsy is performed, local anesthesia might be used to numb the area. If the biopsy is done through the skin, local anesthesia is usually applied. However, if it's done internally using bronchoscopy, sedation or light anesthesia is often given to keep the patient comfortable. An intravenous line may also be placed to administer medications and monitor vital signs during the procedure. Now, the physician will insert a very thin, hollow needle into the lymph node. This needle is attached to a syringe. The doctor gently applies suction to collect cells or fluid from the lymph node. Sometimes, they may need to make multiple passes to ensure they get enough material for testing. After the sample is collected, it is sent to a pathology lab for analysis. The lab will check for cancer cells and help identify the type of lung cancer if present. The entire process usually takes about 30 to 60 minutes. Once the needle is removed, the doctor will apply pressure to the biopsy site to reduce any bleeding and place a small dressing over it. Generally, no stitches are needed. Patients are often monitored for a short time afterward, especially if sedation was used, to watch for any complications like bleeding or pneumothorax, which is an air leak in the lung. This fine needle aspiration biopsy is valuable because it is less invasive than surgical methods like mediastinoscopy. It carries a lower risk of complications and can often be done on an outpatient basis. By confirming whether the lymph nodes are involved, this biopsy helps accurately stage lung cancer, which is crucial for deciding the best treatment plan and understanding the prognosis. In summary, a lung cancer lymph node biopsy with fine needle aspiration involves using imaging to guide a thin needle into lymph nodes to collect cells for testing. This safe and effective procedure plays a key role in lung cancer diagnosis and staging. Always consult with healthcare professionals for personalized medical advice regarding any concerns.